There was some confusion about the structures at the level of certain cervical vertebra. So I decided to do this video and cover sort of all the structures at the level of different cervical vertebrae. Okay, so I also thought utilizing this dissection from different areas of the curriculum, which basically covers, the structures at the lateral side of the neck, to identify these structures as well. So it will be sort of combination between, studying, the dissecting anatomy and also knowing some knowledge about the levels of the cervical vertebrae. So I'm gonna start. I'm sure that you all know that number 18 is the hyoid bone, right? Um, and hyoid bone, what we need to know is that the level of the hyoid bone is at C3. Okay, that's first of all. Um, we also know that the common carotid artery divides into, the internal and external carotid artery at the level of C4. So it will be sort of just down there, right? Just below C3. So that will be the division of the common carotid artery into external and internal carotid artery. And if you extend it to the other side, just below the hyoid bone, you will find the upper border of the thyroid cartilage, all right? So the upper border of the thyroid cartilage would be at the level of C4. So now we've covered C3 and C4 from our previous knowledge, basically. Amazing. If we go a little bit down first before we go up, we're gonna have C6 and C7. I'm gonna leave C6 to the end, despite it's the most important question among all of them. So we're gonna go to C7 first. So at C7, we all know from the spine anatomy that the cervical spine process of C7 is the longest one among all of them, and that means this is the first process to be felt. Okay, the first process to be felt. In addition to that, we have that something called this stellate ganglion or cervical inferior cervical ganglion will be felt at the level of C7 as well. Okay, if we go to C6, which is quite an important question, and this is the commonest question in the exam. So we're gonna have some arteries. All right, we're gonna have some arteries and or some vessels. I would like to call it vessel instead of arteries. You're gonna have some vessels, and we will have some tubes, and also a cartilage as well. All right. So let's go a little bit back. So we said that the thyroid cartilage is at the level of the C4. All right, and we said hyoid bone. So basically, you have hyoid bone and then thyroid cartilage in between the thyrohyoid membrane. And when you go further down, you're going to find the cricoid cartilage. So the cricoid cartilage will be sort of here. So this is the cartilage that you're going to find is called the cricoid cartilage at the level of C6. Okay, you have two tubes, which is basically the larynx and the pharynx. So the larynx will continue as the trachea, and the pharynx will continue as the esophagus. All right, so these are the two tubes and the cartilage, which we mentioned. We know again from the spine anatomy that in all the cervical spinous process, we do have sort of foramen transversum and all the cervical vertebrae apart from C7. Okay, C7 might have a very small one or even aberrant or not there at all. So at the vertebral artery, the cervical part of the vertebral artery or V2 enters from C6 all the way up to C1. So again, you can say that the vertebral artery will be in this area. The other artery is the inferior thyroid artery. The inferior thyroid artery will enter the gland, the thyroid gland. So inferior thyroid artery. I think it was mentioned before as superior, but the answer is wrong. It's the inferior thyroid artery, because as you can see here, this is the superior thyroid artery number 56. All right, so it's the first patch out of the external carotid artery, so it will be, of course, at sort of C4 or even C3. That's the superior thyroid artery, so it's far away from C6. The inferior thyroid artery will come all the way down from the the thyrocervical trunk of the subclavian artery, and then will go up and enter the gland from the lower border. The other thing is the thyroid gland boundaries extends from C4 to C6. So the superior thyroid artery, which enters from here, will never be at C6, but the inferior thyroid artery will be at C6. You have also the middle thyroid vein will exit. The middle thyroid vein will exit the thyroid gland at the level of C6. So that will be the next one. So middle thyroid vein as well exit at the level of C6. All right. So again, to provide the structures at the level of C6, we have two tubes, pharynx and larynx, turning into the corresponding structure. We have the cricoid cartilage. We have a few arteries and veins. So two arteries and veins. Vertebral artery enters the foramen transversum of C6, and also the middle thyroid vein will leave the gland. Inferior thyroid artery will enter the gland. If we go back to C1 and C2 as well, you have at C2 superior cervical ganglion. If you remember, C7 was inferior cervical ganglion. And finally, C1, you have a spinal root of the spinal accessory nerve. So this is the spinal accessory nerve number one here. You have a branch, the spinal root coming out from it. So basically, the spinal accessory nerve is a branch that taken some sort of a cerebral or an origin from the brain, an origin from the spine as well. So you have here the spinal root of this nerve is coming at the level of C1, and you can see the dens at this level. The dens will be at this level as well, of course, because the dens of the axis will be pointing upward at the level of C1. Okay, so quite an easy question, quite important structures. So I felt like combining those two would be really helpful for remembering this. Thank you very much.